month, we decided to go a little bit about personal care and why it's essential, and go into specific personal care needs that we all face when we are caring for individuals who have dementia, whether it be in a community. I heard some people say that they were working directly with individuals in a skilled nursing facility or an assisted living setting. I heard others say that their loved one had a diagnosis. Maybe it was recent, maybe it's been a little while. So we're going to go over personal care needs. As you can see here on the chart, it breaks down those with dementia and without dementia. So as we age, there are some things that we are going to have help with. One of those things is referencing personal hygiene. As you can tell by the chart, people with dementia are more commonly going to need some more assistance, whether that be verbal cues or whether that be assistance with reminders, reminders set on cell phones or things like that they have now, depending on where they are in their diagnosis. So throughout all these items, we're going to cover all these this evening. We're going to go with toileting. We're going to talk about mobility. We're going to talk about nutrition and how important that is, as well as we'll touch base a little bit on wandering. So we're going to go through all these items here in just a few minutes. If you have questions, I encourage you to write those down as we go through. We will have time at the end to get questions and answers. If I don't have an answer for you, I promise you I will find an answer, or I will do the best I can to give the best answer that I've seen in my experience working with seniors in the senior living industry. So people with dementia are less able to take care of themselves, as we all probably know, especially as the disease progresses. 16.1 million Americans provide unpaid care for someone, and that is very common. A lot of times children or spouses or anyone in the family, brother, sister, church member, these people feel obligated to provide service and provide the care for their loved one. And so sometimes they do it at the home until they decide to put them into a community. But it is not uncommon that people who have someone with dementia do have do provide that care and don't receive payment for it. They simply do it out of the kindness of their heart for their loved one. All right, so our first topic that we're going to touch base on this evening is going to be nutrition. Good nutrition helps individuals with dementia. It not only helps them live longer and healthier, but it does go into other factors that we'll discuss this evening. So it's important to ensure that they're getting a well-balanced diet as best we can. We do know that weight loss is common in dementia patients. So the reason weight loss is probably common, one, your taste buds are changing, like we said. They don't enjoy the things that they may have once. They may want to eat sweets more frequently. They forget to eat. If we as a family or as a community, if we are not reminding them prior to coming in or by leaving work, they may have thought they'd eaten, but they probably may have not ate that specific day. And we come over in the evening and realize that their breakfast that we had laid out for them had never been touched, and they have maybe drifted off to sleep throughout the day and have never had anything to eat. And we also need to make sure that the meals that we are choosing, we really need to find what is appropriate at the different stages of dementia. So we always, in my past, have done Ensure and Boost for individuals that may not have wanted to eat at mealtime. They just simply refused. We offered anything from breakfast food to a hamburger to something like a sweet, and they just refused. So it is important that you keep Ensure and Boost on hand. If they don't like the taste of it, you can always make a milkshake. There are things that we can do to make it more appeasing to them throughout the day. It is important, again, to help them maintain their weight. And vitamins and supplements are also important, and ensuring that they have plenty of fluids. So if they have, I know there's been people in my past that like Cokes, and that's great, of carbonated drinks, but we also need to encourage fluids, water. So even if you have to set a drink beside them and they drink on that throughout the day, or if they have a caregiver in the home, ensuring part of their responsibility is to make sure that they're drinking so many glasses of water per day, along with something maybe like a Coke or something that they enjoy. It is important that we ensure that they're getting plenty of fluids, so therefore we can keep them out of the hospital to prevent dehydration. Another important topic, as we all probably are aware of, is meal preparation. So ensuring that the meals are appropriate for each stage. So initially, when someone gets a diagnosis, they may be completely fine and aware and not have any issues. But as we move on throughout the years and months ahead of us, we need to make sure we're changing that habit of what we make. They may have trouble swallowing eventually. They may prefer, especially in social settings, especially out to dinner, they may do better with finger foods, things like that, that they do not have to use a fork or a spoon to do so. And the other thing that I have experience with, and I'm sure most of you as well do, especially in a social setting, in a senior care setting, a lot of times we offer, if we see an individual having trouble cutting up their food, we will do that in the privacy of our kitchen. So we don't want to embarrass them, or we want them to have dignity. So if you see a loved one of yours struggling with cutting food, it's simply better to go ahead and do that prior to bringing the food out so that they are ready to eat once it arrives. Okay, so those are simple things, things that we may not think about, but as we change and as their needs change, we need to adapt to the change that's more of their reality. It has also been shown that if they eat with someone, they tend to eat more. So they're not sitting at them by themselves. So it is important that if you even just want a snack or whatever their routine is, that someone is there to eat with them, that encourages them to eat what has been offered for them for that mealtime. And also, it has been recommended that 5 small meals are going to be maybe a better idea with a dementia diagnosis than the 3 big meals per day. It seems like that if they have 5 smaller meals throughout each day, they tend to want to eat more at that setting than the 3 large meals a day. If someone that has been newly diagnosed, it may be just that they need verbal cues. So again, it's time to eat. Maybe encouraging them while they're sitting there what they have to eat on. Make sure that they're not waiting for something. So if we have to cut up our food or cut up someone's food, let's go ahead and do that before we get them to come to the table to eat. So it's there and they can simply start eating as quickly as possible. And again, eat with them, even if you're not really hungry, or if a caregiver is in the home or they're living at a senior community. It is important that they are reminded to eat with them so that individuals will be encouraged to eat as well. Okay? The next thing, and I know probably those of you who are here tonight have maybe faced a challenge with bathing. I know in my history in senior care, this has been something that seemed to be an ongoing battle and individualized. So I can remember, I was telling Hallie a story earlier today that a lady that we had cared for had actually was scared to get in the bathtub. She, in her mind, thought she was going to possibly drown. So we started to identify that through talking with her POA, and we started doing a shower, and we started simply just doing the lower legs and working our way up, but kind of talking her through that process while we were doing so. So, it is a tough thing, and it is recommended that they get a bath, a full bath, whether that be a shower or in the bathtub, whatever is appropriate, at least once a week. Okay, some of you may be saying, oh, that's not enough, but once a week is what is recommended. Sometimes it can be up to twice a week. Now, when once a week means that we are getting them in, but on the other days, it is important to make sure that they're getting a sponge bath, something that is to their comfort level, and we need to make sure they're doing so. So we probably have all been in the situation where they've said they've done it, but then we go in there and the wash rag has not been wet, the soap is still dry, and they have never actually performed a sponge bath. We want to allow them to do it themselves if possible, but sometimes doing it themselves is going ahead and laying out the wash rag, getting it wet, lathering it with soap, doing all the steps for them, and all they have to go in and do is simply pick up the wash rag. And at that point, we're really more concerned about the odor areas, the underarms, the private areas, things that we need to ensure that are being cleaned on a daily basis. Okay. If the loved one is still at home, reminders may be of help, whether that be a phone going off or an alarm clock, or simply you calling them and telling them you need to go get in the shower. I'll call you back soon, but please go ahead and take your shower or your sponge bath, whatever is more appropriate. And then find out their preferences. Some of the things that we notice that the families come into senior care or have had someone in the home, sometimes they're just not comfortable with that individual, whether that be that person is someone that they just don't feel safe with. So it's important to identify whether that person is refusing or whether they're resisting and try to overcome that. So if an individual is refusing for a shower, again, we need to identify why that is. Are they scared of the bathtub? Do they feel like they're going to have some, a lot of time it's out of fear. Not every time, but sometimes it's out of fear. We need to make sure the person is comfortable with the individual performing the bath and make sure they have the safety equipment in place so they feel good about what's going to happen prior to taking the shower, and involve them in that. Tell them, okay, in 10 minutes, we're going to get in the shower. And again, they may not remember, but let's constantly try to do that as a loved one. And they may tell you no 10 times, but reattempting, if we don't do it on Monday and we reattempt later and we still are not able to perform that, it is okay to just do a sponge bath and maybe reattempt on Tuesday. That person or that individual may have a better Tuesday than they did Monday. We cannot beat ourselves up. We have to ensure it's done. If you as a family are unsuccessful, then it is good to bring in people like Home Instead and MASH, or look into communities, or look into their family members or church members to come in if they feel comfortable with doing so, to make sure that's being done. It's good to remember kind of what their life was before. If timing is helpful, sometimes it has been helpful if someone was a third shift nurse and they got up early and they got off work and they came home and take a shower. It may be better to do the shower early in the day, like they would had they still been working. Or the opposite, if they were a teacher and they took it after their work day in the evenings, it may be better, and it may be better received if we do it in the evenings. I'm guilty of this, and I'm sure we all are. It is okay to tell white lies. A lot of times I would say, hey, family's going to be here in an hour to pick you up. We have to get in the shower. No. And then we try again. Finally, we were on some occasions successful, and the family may not have been there in the hour, but they were there later that evening, usually to take them to dinner or something. So once we kind of tell them, if they have something to look forward to, sometimes that is a successful thing that we can do for them. Not always, of course. These are not 100%, but it is a way. Telling white lies, even though we may feel guilty on some of them, it is a good way to encourage your loved one to get in the shower. And again, like I said previously, it could be that they're just uncomfortable with who's providing the shower. It may be good to try multiple people. Again, it could be a family member, it could be a church member, it could be an agency out there. But one of the things we know is that if people feel comfortable with whom's performing that or helping them perform the shower or bath, you'll see a better success rate. And once you find a good one that your loved one feels comfortable with, don't lose them. I mean, really try to keep that person, because sometimes that's the hardest thing that we can do, is find the right person who they feel comfortable with. So, all right, our next topic is grooming. This is going, again, it's a personal choice for the individual to perform these tasks, but it is a top priority to make sure that they do so and they feel good about themselves. Shaving, a lot of times these, if they feel good and they feel like still going out and socializing and being around others, a day out to the barber and beauty shop are good trips. We know that most of people, as we get older, we have that weekly beauty shop or barber shop appointment, and that's something that we look forward to. Not right now, of course, with COVID, but we do know that that's something they look forward to doing. So it is important that if that's a way to get that completed, whether that be with their hair or shaving and so forth, maybe make that a trip. And if they get to the point where they refuse that, they don't want to go, they just are refusing to go get their hair done, the day that you do, maybe you getting it cut shorter, because one, it's easier to maintain, but secondly, you don't have to make as frequent visits to get out. Sometimes we see, again, from our initial conversation in July, that self-isolation and all of these things go into play with dementia. So it is easier if you can do some things, and maybe if they're not looking forward to those trips and you start noticing that they're kind of starting to back away from wanting to do some of those social events, just when you can get them there, maybe it's that the hairdresser will come to their home. I've seen people do that, which has been very helpful to families. I always say you can ask and all they can do is say no. And if we are able to find someone to come to the home, that can be of help to the family as well, and to the patient. So it's important also to make sure they're, again, not only doing a sponge bath and making sure that they're cleaning those areas well, but also if we are, starting to smell an odor or something like that, we need to ensure that they have the appropriate items in the bathroom. Again, deodorant. If we are there and they don't know what that is, or they're not sure how it's supposed to be used, it is important that we tell them, remember, that goes underneath your arms, or to allow them to still do stuff independently, but to be there as a family and a support system to make sure those things are being done. And we as family don't want them to be out and have any type of to make them feel like they're not there, and we want to make sure that they are presented well to the community and to their friends and family members. So deodorant, body splash, obviously perfume for women, cologne for men, all important. If they have dentures, that's another thing that we need to make sure that are being clean. If they are in a facility, you can ask that community to put them in a clean solution overnight, and to help out with cleaning those the next day, ensuring that those are being cleaned. Again, another type of grooming thing that we want to ensure that is being done. Things that we can watch, and as we see mom, dad, loved one with dementia not making these a priority, these are just some things that we need to be mindful of as we start trying to develop a game plan with what the next step of their life is going to look like and how we can better prepare ourselves, okay? Our next topic is Trilogy. Again, this is a common occurrence with dementia, is that individuals, even as we get older, and not only with dementia, but we may lose the ability to control our bowel and bladder. And sometimes initially this can cause, an individual to be self-conscious. They they don't know when this is happening or occurring, and they honestly, by no means of it, can't control it always. So as you start seeing this, and again, I've seen this in my career where we've had someone in the dining room or an activity, and they've stood up and they've had bowel and bowel on them, urinary incontinence issues, and so we simply just try to get them and simply try to do it in a dignified way to make sure that they are back into an area where we can get them cleaned up. So that is the best advice as you start seeing your loved one who may refuse to wear the proper supplies that they have now. For them, it's more for them to feel good about themselves when going out, but also it's for us to ensure that they have the ability, if they lose the ability to control it, we have a plan in place, such as the proper adult briefs. Of course, you all probably know they depends. Most women may start out with wearing a simple pad or something like that, but as it does get worse, there are some other alternatives. So if we start seeing this happen, you obviously need to talk to your physician. They're going to be very cautious and watch possibly for urinary tract infections, things like that become common with these issues. But it's also important now that they've come out with some new designs, but to have them provide them with the proper adult briefs that they have access to. They may not want to do it in the beginning, and not everyone is the same. Like I've said always, each individual is unique. So making sure they have those on hand is very crucial. And I will say that we may put them over to the side in a cabinet. And then once we start seeing that it's becoming more frequently that this is occurring, usually we, as well as the patient, can ensure that that's being done and being done frequently. Because again, even though we wear them, it doesn't mean that we have to change them, because again, we're going back to odor. So if they're in a community or if you have a caregiver in the home, you need to make that on a routine schedule, okay? Whether it be, we need to take to the bathroom every couple hours. If they've had an accident, then we need to go ahead and have them change that adult brief. Making it such a routine that is less on them and more of a routine makes it better for all of us, okay? Be mindful, of course. Make sure they're eating enough fiber, make sure they're getting their medications. If they have issues with constipation, we need to be mindful about those things and report those things to our physician. If you think that there could be a urinary tract infection, you smell odor, it hurts when they're going to the bathroom, again, we need to talk to our physician and make sure things are working properly. There's no need for a catheter, things like that, but those are things to be mindful of, and hopefully a schedule providing the adult briefs when they're needed. In the beginning, they may not like that idea, but then at some point, they may not have an option. So it's good that those things are offered at this point. So our next topic is going to be medicines. This kind of goes, we'd say personal care. And personal care for me is taking their medications routinely and on time. Okay. If the doctor tells you that that medication needs to be given in the morning after breakfast, then we need to make sure they're getting that medicine in the morning after breakfast. Some medications cannot be given on an empty stomach. They cannot be given later in the day. So we need to make sure we're giving those on time. If we feel safe and we as a family have decided that the individual is safe and can use a medication box, I know that some of us probably are aware that Guardian Medical does have a medication box that has an alarm, and there's probably other agencies, companies that do as well, and it will say it's your 8 a.m. medicine. And so therefore, it will alert them, 2 or 3 times, however the family sets that up. And if the medication is not given, then later in the day, the family will be aware that that medication was not taken. So it just depends on your comfort level, whether we need to bring someone in the home to help ensure that those medications are being done, or that we need to rely on a community to do so, or if we feel as though the individual is now is better off with a medication box that has alarms and setting reminders, whether that be a family member calling that individual, just making sure that your comfort level is the most important and that their safety is of the most importance. Make sure they have something to drink and that they swallow it, that they don't stick it under their tongue or in their cheek, but they actually took their medications. And sometimes we do have to ask them to open their mouths to make sure it was all taken. We also need to make sure that the person is not dropping medicine. So if you have a loved one you're taking care of right now and you start going in the evenings and you start noticing that you're seeing pills dropped around the chair that they sit in or in the bathroom or wherever it is they spend time, that is also a sign that maybe a medication box, something there are ways to get around that. So we need to make sure that those are things that we're being aware of. And make sure they're able to swallow. As you all know, sometimes as this occurs, we're starting to lose the ability to swallow, and this has happened, and I've seen it firsthand. You know, there are options where you can take the pills and smash them and maybe mix them with applesauce or something. Again, talk to your physician about those options. It also may be a good idea, if they're capable and they have steady hands, that we look for liquid alternatives. So medication is important. They need to take their medications at the designated time given by their physician. If we start noticing that they're dropped or they're not taking them, maybe a medication box, an alarm, or reminders is our next option. If that is not an option, then we need to look into other alternatives. Make sure they swallow and know that liquids are an option, just to talk to your physician, or crushing pills and putting it in with medicine, or I'm sorry, applesauce, maybe whatever they're putting, whatever they enjoy, is another alternative and a sneaky way to get them to take their medications. This is just something we wanted to touch base on very quickly. As we know, not only in dementia patients, but also as we age, falls are very common, but there are several ways to lower the risk. So these are just some alternatives to think about. If you are starting to see, you know, people with Lewy bodies, they tend to shuffle. That is something that is kind of a gait problem. So a walker may be appropriate. We also, you know, there's two options now, a rollator that has the 4 wheels, as well as the standard walker that has the 2 tennis balls most frequently and the rollers on the front, as I see very commonly. Lowering beds, I think that's also common. As you see, families sometimes just put the bed on the floor to make sure if they were to roll off the bed, they would not harm themselves too bad. Footwear, they have lots of great slip-on shoes these days where they do not have to tie their shoes. They simply just put their shoe on. These are things to talk about. In clothing, I have seen also people who have trouble with buttoning their shirts or buttoning their pants. I have seen folks turn that in with Velcro. And so that loved one can still remain independent, less falls because they're not concentrating maybe while they're walking, which, as we all know, they shouldn't do anyway. But clothing can, you know, you can Velcro blouses now. And I've seen a lot of families do that in my past. Lighting, making sure if they have a light bulb out, we get that replaced, making sure that there's no risk for them to fall due to lighting concerns in the home. Non-skid flooring, and of course, we always go back to maintaining a healthy diet. Diet is everything. Water, taking their medicines, eating a proper nutritious meal. 5 meals a day, small meals versus 3 big meals. You all know your loved ones more so than I, but we want to make sure that as we look back at their history and we get to know them in their new normal and embrace their reality, that we know that these are all options to keep them safe. And I also think it's important that if you all have a resource, if you don't, I would be happy to help you. There are people who still have their loved one at home, and that is totally great. But I would recommend a rehab group. I know that Red Banks here locally does go to the home and sends a physical therapist and occupational therapist after a rehab stay, and making sure the home is safe. It makes recommendations for proper equipment that could keep that family member or that loved one at home longer. So there's just some things to think about, that if you have a contact physical therapist, occupational therapist, a local home medical equipment store in Henderson, we have Deaconess Home Medical. We also have Williams Brothers, two great resources and people who can help you identify what may be needed to keep your loved one safe at home as long as possible. All right, now we are going to allow you all to take a few minutes. This is kind of an interactive part, and we want to kind of hear your feedback. So if you don't mind, go ahead and read through these questions and just put your answers down, whether you think the answer to these following questions are true or false. We're not gonna grade it, but we simply just want to kind of go through what we've discussed, because we talked about a lot, and we want to make sure if you all have questions right after this, we will start taking questions. But the number one, the goal for a person with dementia is to lose weight. Number 2, people with dementia should eat 3 large meals a day instead of 5 small meals. Number 3, soup is not recommended for people with dementia. 4, person with dementia must take a full shower every day. And 5, person with dementia may have normal strength in their legs, but they might lose the ability to coordinate. Okay, we'll give you all a few minutes to think about those, and then we will in turn give you the answers. So I'll give you just a few minutes to jot down your answers, and I'll be back on. Thank you, guys. Okay, guys, here we go. For a person with dementia, their goal is to lose weight. We all probably know that answer without having to really do a lot of thinking. We know that is false. Again, we do not want these individuals to lose weight. We want them to maintain weight as much as possible. If they gain weight, that's okay. The doctor will tell you specific reasons, will give you guidelines, but we definitely don't want them to lose weight if we can prevent that. So again, 5 small meals, boost and ensure, dessert if needed, things like that, supplements, appetite stimulants that the doctor can prescribe to help with that are all good recommendations. I've talked about this a lot. People with dementia should eat 3 large meals a day instead of 5 meals, 5 smaller ones. Again, that is false. They are recommending now through my curriculum for certified dementia practitioner that 5 smaller meals a day maybe would allow that individual to eat more at meal times versus the 3 large meals per day. So just think about that when you're wondering if is this person, they're not eating. It may be that it's just too much, and 5 smaller meals may be more appropriate. Soup is not recommended for people with dementia. That is true. One thing we did not talk about, and I'm sorry that I may have overlooked that in my conversation earlier, but meal prep, they do make things, one of the things that we notice is that individuals do have trouble eating with regular spoons, forks, knives that we are used to doing. They do have weighted spoons and forks now that allow the individual to be able to grip easier, and they are weighted and they are larger. Soup is not recommended simply because of the ability that they may drop it. It's hot. You run into some situations where that's not a good idea. But they do have weighted soup or soup spoons and things like that now that have been a huge lifesaver for some of my patients or some of my residents in the past. That is another recommendation I will give you if another if you have an individual that is having trouble with using utensils, weighted utensils are have been recommended, and I've seen some success with those. Person with dementia must take a full shower every day. We know that answer is false. That is not. Sometimes we have to fight the battles that we can take, and if we can get them in once a week and do our simple basin and do some sponge bathing throughout the week, that is appropriate. Person with dementia may have normal strength in their legs, but they may lose the ability to coordinate. That is as well true. So this individual, as we know, as you all know, who work on units that have a loved one who's in this, they walk. And not all of them, but sometimes they start losing the ability to their brain function, but their body still walks. And we see this, and they walk, and sometimes we have the issue with wandering. But they do have the strength in their legs, but sometimes they lose the ability to coordinate. Again, higher risk of falls. Need to look into some proper equipment that they could use, whether that be a walker, a wheelchair, a cane, something like that, at whatever phase of life or whatever stage of the diagnosis they're in. And those things will change throughout their time. And you know, you may start out with a cane, and then see in a year or two they may need a walker, and then a year or two they may need a wheelchair, and then a year or two we may be propelling them in that wheelchair because they cannot do so themselves. Okay. Our next thing that we are going to send out to you all for attending this evening is some resources. We want to provide you with some options that you all can read through on your own outside of this setting. So if you have medication management questions, if you have fall prevention things that you want to look at when you go into the home of your loved one or into the community, things that you want to be mindful of, these are good resources for you all to use. I always say reading and kind of talking through things is the best thing to do when we're caring for individuals. So these are just some resources that myself and Hallie will send to you all. We'd love for you to look into those a little bit further if you're able to, and let us know if you have further questions, okay? So now I will take questions and answers. If you all have questions, just tell me who you are, unmute yourselves, and I will do my best to give you the answer that I have. And again, if I don't have an answer for your specific question or a recommendation, I will do my best to find you something. So please feel free. Carrie Lane, I see you've raised your hand, so feel free to go ahead.
I like that little thing there.
Is this Carrie?
Yes.
Yeah, okay.
It is, yes. I'm sorry.
You're okay.
Can you hear me okay?
Yes, ma'am.
Okay, good. So I noticed you had said that you were going to kind of touch on the wandering aspect of it. So my question really kind of relates to that. My dad was diagnosed last year with Alzheimer's. He is still in early stages of it. But so this is kind of more for a down the road aspect of it if we run into this. So with the wandering, do you know of like anything that you can do for like tracking purposes?
I do. There are a lot of options out there. There are I know a family that had lived with me at my prior employer. There was an app. I don't know that your loved one, has a cell phone that they carry with them everywhere. There is an app that this family had used, and they downloaded, and it was like a tracker that that if dad, it was a gentleman, if dad had gotten to in a cab or had gone somewhere and they were not there, he was still at this point living in the home. And so they would send him, they would be able to track him if they'd gone to the home and he was not there. So that is one idea that you can look into. There is something on a cell phone app that you can do, and it was successful for one family that I had worked with in the past. There are other alternatives that I could send you, Carrie. There are things that you can put on your wrist that look like a watch that do help some tracking. There's Guardian Medical that does some tracking devices as well. There's a lot of things out there right now because a lot of people are trying to keep their loved ones at home as long as possible. And I would be happy to send you some of those options that you can look into as far